Hi guys, welcome back to my channel, or welcome if you are new. My name is Holly. I do mummy and lifestyle videos, and today we are doing my 25-week pregnancy update with baby number 4. So in today's video I'm going to be talking a little bit about baby development at 25 weeks. I'm also going to be talking about what my physical pregnancy symptoms have been over the last week. I'm going to talk a little bit about my mental health and emotional health during this pregnancy, and then we will finish with a belly shot at the end. So first things first, and I want to tell you guys a little bit about how baby is doing and baby's development. So according to whattoexpect.com, baby is packing on the pounds this week, and that is certainly the case with this little one. We did have a scan and they did actually tell us the weight of this baby, and it is definitely a chunky little thing in there. So baby was measuring exactly 2 pounds, and when I googled it, babies around this gestation tend to weigh about 1.7 pounds. So this baby is definitely a chunky little thing. They did actually, when I've read the scan report, baby is measuring just below the 90th percentile. So considering our 2 last pregnancies we had growth issues, it's crazy to now think that we are having a bigger baby so far. So fingers crossed it will continue to grow, although it does make me slightly nervous because of issues in the past with my scar, and my scar did actually start coming apart with a baby that was very small in my last pregnancy. It makes me nervous of having a big baby, so that is something that I'm hoping to discuss later on in the month with my consultant. And apparently the startle reflex is starting to develop as well, so that's something that I know they test when baby is still in hospital, the kind of jumping when they almost like drop the baby but not properly drop it, and it kind of flings its arms out, and that shows that it has this startle reflex, and so that is starting to develop now. And apparently the nostrils and nose are starting to work and develop now, so baby is practicing breathing in and out of their nose with the amniotic fluid, and they may be able to detect smells as well, although if they can't now, they will soon be developing that sense. So that is everything for baby's development for 25 weeks. So physical symptom wise, there's been a few things, but generally I've had quite an easy week. I've been pretty active, which has been nice with just not having the joint issues. I'm getting out and walking a lot more, getting out into the outdoors as much as I can, so that's really boosted my mood. But I have had some other physical difficulties besides the obvious needing to pee 1,000 times. So one of the issues that's maybe made me the most nervous has been the discomfort that I've felt around my scar. I have actually had a midwife appointment this last week as well, and so I have discussed that with her, and she was quite happy that the issues that I was having were normal and not to be concerned about. But she did also explain to me when it would be a time to worry and to make sure that I phone them if I had any intense sharp pain, which I haven't had. It's just my scar is very uncomfortable and it has like niggly, just not sharp pain but just discomfort and pain, but not to a degree that they are concerned about. But it is something that I will be monitoring, and it does make me nervous. Like I mentioned, I'm nervous with having a bigger baby as well. This baby is actually weighing more now at 25 weeks than my daughter that passed away. She was born at 32 weeks and she was measuring so far behind that this baby is actually weighing more than she weighed at birth at 32 weeks. So this is definitely a chunky little thing, and it does make me a little bit nervous. Another physical symptom, which I guess isn't really a surprise considering I am 6 months pregnant and I am obviously growing a little child, and I'm also still breastfeeding once a day with my 20-month-old. I think she may be 21 months old now, but that is exhaustion. I am completely exhausted all the time. I need naps when I can get them, or I'm just needing to sleep more in the morning, so I'm having to really rejiggle how I plan my days, and I am having to be more realistic of what I do and what I expect my body to be able to do. And so I'm asking a lot more for help from Fabian because I just physically can't do all the housework and be pregnant, and it's just really, I'm just really exhausted. But it's not something unexpected, it's just difficult to emotionally manage with, which I will talk about in a minute. And probably one of the most frustrating symptoms I'm having is restless legs, which I've mentioned before, but for some reason in this past week it is so persistent, and it is every night, and it's only in one leg, and it's the leg that I tend to have my hemiplegic migraines. It's all on that side, but it is just, my leg is so restless and it is just awful trying to fall asleep. Thankfully I have got some stuff. I will insert a picture, and it's basically stuff that you put on your feet normally as like a pampering thing, but it literally has this cooling effect that's quite long lasting, and so I get Fabian to rub that on my leg just before going to sleep, and that really seems to be the only thing that's helping, because I can't keep stretching my leg but then expect to be able to fall asleep. So it gives me a long enough lasting cooling relief that then I can fall asleep, and I don't seem to then wake up with it during the night. It just seems to be when I first go to bed. And I think the last thing that I'll quickly mention, because I don't want anyone to be like speculating, but as you can see I'm not wearing my wedding rings. I did mention before about that my hands kept swelling up, and they're not swollen all the time, but if I get dehydrated or too hot they do swell up a lot more, and it just becomes uncomfortable with my rings. So I have decided, which I have done this in all my pregnancies, I've taken my rings off for now, I've put them in a safe place, and then once baby's born I'll just put them back on. It just makes it more comfortable for me. So yeah, that is my last symptom that I really wanted to talk to you guys about today. So moving on to talk about my emotional health and mental well-being. I would say it's similar to last week in terms of difficulties with anxiety. It just seems I'm very anxious all the time at the minute, and a lot of it is external factors, unfortunately, with the COVID and its impacting finances, or we're still trying to recover from when COVID kind of first hit our business and stuff. So it's a lot of external factors, but it seems that it's been compounded by these crazy pregnancy hormones. And I found, especially this week, I'm definitely the crazy pregnant lady that just cries at everything and anything, and so I'm just very emotional, hormonal wise. So when I've got external stressors that are then getting involved and all that, then it does just kind of accumulate into more than it necessarily would be, and I just have very difficult days sometimes. So it's been a bit of a roller coaster this last week, but I feel quite positive that this next week is going to be better. I'm a lot more positive right now, and I'm getting myself organised over the weekend, so then I know for the next week everything's sorted, and it will give me the peace of mind to be a bit more relaxed. And I'm just trying to always keep on top of the things that I know make my mood feel good, and always communicating with Fabian and kind of letting him know where I am mentally so that he knows how to support me as well. And I think especially one thing that I found the most difficult emotionally to deal with is the fact that I'm so tired all the time, and I'm just one of these people that always has a lot to do, and I always want to do a lot, and I make these to-do lists, and I just sometimes expect too much of myself. And so it's just a case of I'm starting to now learn to ask for help, but it is just emotionally difficult for me to accept that I need help, and accept that my body is just not able to do the things that I used to do, and just mentally trying to accept my pregnant body and my physical state. So yeah, that's just one thing that emotionally I'm trying to get through this week, but I am learning to relax, and I know how important it is that my body is doing such amazing things, and that's more important that I'm taking care of myself. So I'd rather make sure that I'm looking after myself and my body and baby, and then all the other things can come afterwards, and we just want to make sure that we have a healthy baby. So I think that's pretty much everything for this week's update, so I will show you guys my belly. Okay, so this is from the front, and I'm wearing pyjama bottoms, but it is a maternity top. I have kind of got dressed today, or at least half dressed, and that's from my right hand side. And then here we go, and like even now it just feels like my scar is so like tender and uncomfortable. But yeah, and then that's from my left hand side. So it's just really, I can tell there is a big heavy baby in there. I'm still interested to know, I can't tell, because I want to check and test gender theories, so it'd be interesting to know if you guys think I'm carrying high or low. What do you guys think? And then I will include that in my gender predictions video if you vote down below and let me know what you guys think. So thank you so much for watching my video. I hope you enjoyed. If you did, make sure to give it a thumbs up. I really do appreciate all this love and support that I've been getting through sharing this journey on YouTube. And if you are not already subscribed, then please do subscribe down below for more mummy and lifestyle videos, and I look forward to seeing you guys in my next video. Bye guys.